Recognition of the need for a greater focus on the health of women and children in the United States led to the creation of the National Institute of Child Health and Human Development in 1962. But actions by the Trump administration are jeopardizing the future of the institute and the progress it represents. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Amanda Kallen, an associate professor in the Division of Reproductive Endocrinology and Infertility at the University of Vermont Larner College of Medicine and an adjunct professor at the Yale School of Medicine. Dr. Kallen has co-authored a perspective article about the history of women's health research and threats to its future. Dr. Kallen, what types of research or areas of medicine fit under the umbrella of women's health?
What I would say is that the umbrella of women's health research is so much broader than I think traditionally people think of it. And that was part of what spurred us to write this piece. I think traditionally, if people think of women's health research, they think of sort of women's specific health research around things like pregnancy, infertility, menopause. But women's health research, you can almost use the term healthcare for women instead of women's health. Women's health research really encompasses healthcare for women. And so we think of things like research into cardiovascular disease, research into long-term morbidity and mortality, research into differences in the prevalence of Alzheimer's disease between men and women, research into the outcomes of offspring after pregnancy. All that fits under the umbrella of women's health research. And one of the points we really wanted to make in the piece was that this work not only benefits women, but also benefits men, families, children, society as a whole. The impact is so much broader than just on the disease or the condition that is being studied.
When did investigators start paying attention to women's health as an area of research? And then when did the federal government start funding it?
So in 1962, the NICHD, which is the Eunice Kennedy Shriver National Institute of Child Health and Human Development, was founded. And this occurred in part based on Eunice Kennedy Shriver's vision for an institute that could focus more specifically on the health of women and children. And I would say that that institute, the NICHD, was the first NIH institute to focus on health across the lifespan, including women's health, rather than a specific disease or illness. And so when the NICHD was created, it became an impetus to fund studies on topics under this women's health umbrella. And like I said, that includes not only kind of women-specific conditions like preterm birth, but also topics like Parkinson's disease, intimate partner violence, septic shock, smoking, postpartum depression, safe infant sleep. While the creation of the NICHD was a great sort of impetus for funding some of this work, it wasn't enough. And in the piece, we talk about an act called the NIH Revitalization Act that mandated that women be included in clinical trials. 25 years after that act was created, the majority of studies still weren't reporting sex-specific results. So that act mandated the inclusion of women in clinical trials. But after that act was created, many studies still didn't sort of tease out results based on whether the participant was a man or a woman. And so what I would say is, while there has been an increased focus on funding for women's health research, it's not been enough. The Biden administration had something called the White House Initiative on Women's Health Research, which was launched, I want to say, a couple of years ago, that was recognizing the inequities and committing millions of dollars to advancing women's health research. But as we go over in the piece, there's really a backtrack happening in terms of that funding.
So where do the gaps persist? What areas of knowledge about women's health are lacking?
There's so many things we don't know. For example, I study the ovary. I study reproductive aging and ovarian aging, and the ovaries are one of the organs that is the earliest to age in humans. And so we know that the lung, the brain, the cardiovascular system age over time. And so those systems are starting to deteriorate as we get older. But the ovary has really sort of ended its lifespan by menopause. So what happens is a woman is born with all of the eggs that she will ever have. She is using up and depleting those eggs over time. Menopause is the culmination of that loss of eggs. And I'm being a little simplistic here, but the eggs are essentially gone. And the production of estrogen by the ovary has more or less stopped to a great degree, whereas other organs function persists much longer than the age of menopause. And we don't know why that happens. We don't know why that organ ages so much more quickly than other organs. And so I'd say one very understudied area, and people starting to pay more attention, but there's still so much work to be done, is in terms of just reproductive aging and ovarian aging. And you might ask, why does that matter? Because one might think that the primary purpose of the ovary is to release eggs and allow for someone to have a pregnancy. But it's so much more than that. As I said, the number of eggs in the ovary drives the timing of menopause. The timing of menopause is directly related to long-term outcomes and long-term morbidity and mortality. And so if you can understand what drives the rate of aging of the ovary, you can then potentially understand what drives long-term morbidity and mortality in women. And trying to understand mechanisms that drive ovarian aging can also be relevant to other organs that age. And so that's just one example of kind of the many areas where we haven't sort of prioritized research on women's specific quote unquote topics. You think about things like Alzheimer's disease and the prevalence of Alzheimer's disease and the severity and the timing of diagnosis of Alzheimer's disease in men and women and how those are different, or how the symptoms of cardiovascular disease and a heart attack are different in men and women. You think about how women are more likely to have reactions to certain drugs than men and why that is, or why disease prevalence or timing of disease or disease severity is different in men and women. All of those are things that research into women's health looks to try and address. And as I said earlier, knowledge gleaned from studying these, what I'd call sex-specific differences, can then promote better health outcomes for everybody.
But in your article, you describe actions by the Trump administration that you say reflect a clear disregard for the health of women and that threaten to dismantle the progress that's already been made in women's health research. What have been some of those actions by the current government?
So the actions that are targeting women's health research include the loss of funding. So billions of dollars in NIH research funds have been pulled back, and those funds cover topics like breast and uterine cancer, obesity, preterm birth, maternal and child health, mental health, suicide, drinking water contamination. All of those funds have been pulled back. And among the research community and the community of people that takes care of women, everybody is feeling shocked and devastated and terrified for work that is ongoing and has now just had to stop. When you think about it, not only is funding for new research being stopped, but funds for ongoing research have been pulled back as well. And what that means is that all of this investment, some of these grants might have 1, 3, 5 years of work already in progress that has just been completely stopped. And what a waste of money and time to sort of take a project midway and stop it and not be able to answer these questions that we're trying to answer. Money for research training programs has been pulled back. So these are training programs, including those aimed at training the next generation of researchers in women's and children's health. There's a program called the Women's Reproductive Health Research Career Development Program at Stanford, and another program called the Cornell Pediatric Scientist Development Program. Funding for both of those has been rescinded. There are government websites with information about topics like opioid addiction, vaccination during pregnancy, and contraceptive choices, safety side effects. Those have been stripped of critical information. And of the websites that are back up, many of them have these sort of caveats that this information hasn't been reviewed by the Trump administration or is in conflict with the Trump administration. There was a congressional appropriations bill in 2024 that included a proposal to fold the NICHD into what would be called an Institute for Disability-Related Research. That change wasn't implemented at the time, but the documents that are coming out now suggest that the plans to do that are reinvigorated, which is essentially a dismantling of the NICHD. We talked about the website being pulled back. There are institutes within the CDC, or the Centers for Disease Control, responsible for monitoring the safety of in vitro fertilization that have been completely dismantled. The director of the NICHD, Dr. Bianchi, who's done just pioneering work around the health of babies and women, was placed on administrative leave. And so we're really talking about just drastic, crippling cuts that run across multiple domains and really threaten the progress that we've made in terms of women's health research.
So finally, What steps can clinicians, investigators, and advocates take to defend women's health research and promote the generation of knowledge in this current environment?
I think one thing is we can use our voices. That's really what spurred us to write this piece, was just this initial feeling of shock and anger and powerlessness that then needed to channel somewhere. And so this has been one of our ways that we felt that we could speak out. I think that a truth of academia is we haven't always been great at communicating what we're doing in a way that the lay public can understand. And so I think sometimes or frequently the wonderful work that people are doing in labs and in clinical research settings, we haven't necessarily translated it in a way that the public can understand and can say, like, oh, this actually benefits me, this benefits my sister, my daughter, my mother. And so I think not only do we need to be speaking to the administration and the people that are making these decisions, but I think we also need to be speaking to the public and communicating directly about what we are doing, how it benefits people now, how it benefits everybody, again, not just the women in our lives, but their children, their families, their partners. We need to speak about the work that's already been done and the many, many sort of benefits, the lives saved from the work that's already been done. And I think we think creatively about ways to keep our work going. We have internal discussions between colleagues of mine. So I'm a practicing physician scientist. I see patients and I also run a lab and do women's health research. And among my colleagues, we talk about there's this sense of despair, like, do we just stop submitting grants right now? Is it even worth our time if there is so little remaining funding? And my take is, I think it is. I'm not ready to stop doing that. I'm not ready to stop the work that I'm doing until I'm forced to stop, and then I'll find a different way to do it. But I think my approach has been to keep writing grants, keep building collaborations. I have absolutely wonderful collaborations in terms of menopause research and ovarian aging research and uterine fibroids and reproductive aging. And all of those things are invigorating me. And I believe that there is benefit to that work for the patients that I see and for the people in our lives. And so my approach has been to try and speak out, to speak up again to the people making the decisions, to speak out to people who may not understand why it is so critical to do this work and to fund this work. And then also just to keep putting one foot in front of the other and moving forward and trying to do the work that I and we do both in the lab space and in the patient care space. And that it's not enough, but it's something.
Thank you, Dr. Kallen.